to you, Tammy. Actually, we're coming live to you from the province's command center, not the Nasrec Expo Center, where the MEC received donations from about 5 companies. They donated, PPEs, sanitizers, technological equipment, and the like. So those come just as the province is preparing for the surge of the pandemic. Currently in South Africa, we have over 97,000 cases, and over 20,000 of those are coming from Gauteng itself. In fact, the MEC is saying that, they are already starting to see all those signs, and he joins me live now to talk more about these, implications and these donations that you're receiving. MEC, thank you so much for your time. Let's talk about the issue around receiving these PPEs. You sound like someone who's expecting the peak quite earlier.
Yeah, I think we do appreciate the donations that we've received. And all the time we've been saying to the public that we receive them, these donations, on behalf of our healthcare workers, because they will come in handy in the daily work that they do every time, particularly the sneakers and the face visors. Yes, indeed, we are seeing signs that the surge is coming. In actual fact, with the numbers as they've grown over 300% in the last week or so. We are seeing at least 5 deaths in every 22 days, which is something of great concern. Though the demographic of those people who actually demise still reflect what we have been expecting in terms of the old age and those who've got comorbidities.
And talk to us about the preparation then. I mean, the last time we saw the province preparing Nasrec Expo Center as one of the field hospitals. We also know that the Western Cape has started receiving patients. Have you started receiving patients? What is the preparation looking like in terms of those field hospitals?
You'll remember that we had opted to build capacity within our facilities, but we then now took a decision because we see the surge coming in earlier. Now we are looking at putting up field hospitals with activating the hospital site of Nasrec quite early, the 500 beds, and also in discussion with other departments like Public Works and the South African National Defence Force. We are preparing extra 2,500 beds, which are going to be field hospitals, in case we are going to require more capacity in that regard, using the principle that those who require critical care will be first taken care of in hospitals, and then when they require less care, they will then go to the field hospitals. So that's what we are doing now, and that's what we are preparing in the next coming month or so.
You also mentioned that there's about 5 healthcare workers in the province that have tested positive. We know that, that has been of great concern. I mean, what is the driving factor? Is it in these hospitals? Is it from patients, or is it from amongst themselves? What is the trend that you are seeing as health workers?
Yeah, the number that we are looking at now of positive COVID actually healthcare workers in our department is around 341. The 5 that I was talking about are those who actually demised because of the infection. So we are looking at different surveys that we have been put in place. We've done one in Helen Joseph, which by and large has indicated to us that the healthcare workers who got infected, actually they didn't get the infected from the patients themselves, but they got infected from their other colleagues who were infected. So we are continuing doing the drill down of all these cases. The next stop, we are going to Kopanong, which had a bigger surge of healthcare workers who were positive. We're also going to see what will be the trend in that hospital.
And quickly, before I let you go, talk to us then about the shortage of testing equipment. That is, of course, of great concern as we try to get more and more of these cases. How is Gauteng looking like in that regard?
You will know that there is a global shortage. It's a global phenomenon of the shortage of the testing kits. Gauteng had a backlog of 30,000 test specimens that were not tested. That was 3 weeks ago. But we are fast actually cancelling out the backlog. The concentration was in Western Cape in the past 2 weeks. So now it's our turn as actual Gauteng. Hence the numbers you are seeing in terms of the surge on the numbers of the others positive cases that we are seeing.
All right, so there you have it. Gauteng Health MEC there, Bandile Masuku, giving us a